Good morning. We're going to go ahead and call the Higher Education Subcommittee of Education and Health to order. We'll call the roll.
Senator Van Valkenburg. Here. Senator Aird. Senator Head. Senator Pillion. Here. Senator Locke.
Here.
You have a quorum, Madam Chair.
Thank you all. Before we get started, Senator Surville has asked that Senate Bill 501 go by for the day. It's been moved and seconded. Senate Bill 501 go by for the day. All those in favor, please say aye. Aye. Okay, so that one is by for the day. We have Senate Bill 21, Senator Salim. Senator Salim.
Thank you, members of the subcommittee. I'm here in front of you today for SB 21, which was standardized documentation requirements across public colleges and universities in Virginia by requiring these institutions to accept a variety of documentation as proof of disability, streamlining the process for students to qualify for accommodation. The bill aims to eliminate the need for unnecessary, often costly psychological and medical evaluations for students with previously documented disabilities. The reason for the need is that it eliminates the financial burden that students with disability go through, whether it's having the reevaluation done or proving the fact that they have that disability when it does not go away, and institutions do not currently address that. And of course, it's addressing the discrepancy in accommodation rates where, statistically speaking, 94% of students with specific learning disabilities receive accommodation in high school, but out of that 94, only 17 receive some kind of accommodation in college. So I ask that you all support this and move it on to the full committee. There is somebody who's here who would like to testify in favor of this bill.
Are there questions from the committee on Senate Bill 21? I do have a question. So if the higher education institution, I'm not clear in terms of what it is that you are asking the institution of higher education to accept. What are you asking them to accept for the accommodation?
So I want to bring someone up who asked for this specific bill, and he's going to be able to explain that.
Thank you, Senator Salim. Madam Chair, this bill my name is Matthew Savage. I'm a member of the Young Adult Leadership Council of the National Center for Learning Disabilities and from Falls Church. This bill would specifically require colleges to accept a 504 plan, an IEP, a documentation from the armed services, or a documentation from a previous college or institution that a student attended that documents that they have a disability, that they've previously received accommodations in the past. And it has a specific provision in it that says if you had a 504 plan in, say, 9th grade, and then you're asking for accommodations in college, and you didn't have a 504 plan when you graduated high school, if it wasn't immediately in effect when you were at your most recent institution, the college can request additional documentation. But the problem now is no college is required to accept a 504 plan as proof of a disability, even though if you're like me and you have dyslexia, you were probably diagnosed in kindergarten or first grade and haven't had a psychological evaluation since. Thank you.
Thank you, Madam Chair. So then my question is, or maybe it's ends up being many questions, but I guess my first question is, and I might be wrong, but doesn't the IEP or 504 end when the kid graduates unless it has to be explicitly re-upped, right? So like if you're 18 and you're a senior and you're about to graduate high school, doesn't that IEP or 504 end when you graduate unless you go through another evaluation? And so what I mean by that is, you're asking them to accept something that's done, right? Do you see what I'm getting at? Like, don't they have to go through another process to re-up that they need the accommodation?
Correct. So the IEP does expire within a certain time frame. We're still asking if they would be able to accommodate that on top of, the universities do have the flexibility to ask for additional documentation to prove that somebody has the disability and they can accommodate. So yeah, you are correct in that sense. We're not specifically asking them to accept just that documentation, is that that specific one should be included.
Follow-up question. Okay, so if they have to accept it, even if it's defunct, I guess, how would they then would they have? I guess the bill's silent on this. Would they have to go through a re-upping process, or would they just be using that IEP or 504 from when, let's say it was done when they were 14, but now they're 22? Is that same IEP or 504
So
going to have to be used? Does that make sense?
in the House version of this bill, they do have a substitution to add a year limit on how far back it could go. And I believe it's being heard right now, or it was heard earlier this morning, and they determined between 6 to 8 years is how far they can go back and use that IEP documentation. And we have not made that substitute motion yet. Yes. There we go. I would like to offer the substitution to include the number of years that the documentation could go back. Correct. And that specifically clarifies that a record or evaluation from a relevant licensed professional finding that the individual has a disability, providing that such record or evaluation was completed no more than 8 years prior to the student's application for admission to the institution.
Yeah, move the substitute.
I have a question on the substitute then. So in essence, a 504 or IEP that's been in place since the child was 10 years old can be adopted by an institution of higher education?
Correct. It originally, when the bill was written, it allowed, if we moved forward with that, it would have allowed anyone, even if you're in kindergarten or wherever, even though it expired, would be carried over. But we spoke to some of the universities and went back and forth between the year of how far back they could go, and they had the same concern. Somebody gets it in 6th grade, how far can they carry that without a reevaluation? And the numbers went back and forth between 6 to 8, and I believe the House determined it was 8, and hence the substitution.
I mean, that causes me some concern, that if there is not any reevaluation from the time that someone was 10 years old and then enters college, and there's no reevaluation for an accommodation for 504, that's just problematic for me.
Correct. If I can clarify, so the universities would be able to accept this and ask for additional documentation if they determine the IEP documentation is not substantial in order to get the disability services. So this does not exclusively make it that the IEP documentation would be the only source to determine that. It is still up to the discretion of the universities to make that determination.
Yeah, Madam Chair, I think to your point, I think you guys are talking about two different things, because I think for the number 1 and number 2, now that we got the substitute, it does have that language about if it was not in effect immediately prior to the date, but for number 4, it doesn't. So for number 4, if a kid didn't have an IEP or a 504 for whatever reason, you would just be depending on that licensed professional finding, and that would be, to the chair's point, you could be 10. So, I mean, I think I would be inclined to shorten that to shorten that time frame too, because the guardrail is on the IEP and 504 process, but the guardrail's not on the, if you were doing it outside of the school process. Does that make?
Yeah.
And I think I would be inclined to shorten that time period, if that's okay with you.
Yeah, Madam Chair, that'll be okay with me.
Well, maybe question for council. Council, for number 1 and 2, just so I'm reading this right, the college can ask for extra paperwork if the IEP was not in effect when they graduated, right?
Madam Chair, yes, Senator. Subdivisions 1 and 2 of subsection A do both state that if the Section 504 plan or IEP was not in effect immediately prior to the date on which such individual graduated from high school or was otherwise not enrolled, the institution of higher education can request additional documentation.
So, I mean, I think I would want to change that 8 to like 2 years prior or something like. Yeah, so I would move to strike 8 on line 30 and put the word 2.
So moved.
That is okay. Thank you, Madam. Madam Chair, that would suffice on my end as well.
Are there those here in support of Senate Bill 21?
I'm going to have the same gentleman that came up.
Okay.
Thank you again, Madam Chair. Just to clarify some things, because I think there is a little bit of confusion. First of all, a 504, if you have a 504 plan or an IEP, you have an annual meeting in elementary or post-secondary education where you do annually review what accommodations you receive. So this bill would not require the college or university to look at that IEP and say, this student got extended time, we're going to carry that over. It would merely require the college to look at the IEP and say, this says the student has dyslexia, we're going to look at accommodations for dyslexia. Or the student has a hearing impairment, we're going to look at accommodations for that. It does not require them verbatim to copy over what the IEP or to extend it or the 504 plan. It just requires them to use that documentation as proof of disability, which is the problem today where they can say, if you got a psychological evaluation, I have one. My most recent psychological evaluation was 7th grade. If I were to have to get a new one, which a college could require me to do in order to receive accommodations, that would cost hundreds, if not $1,000, which is completely medically unnecessary and would be, quite frankly, a waste of money in order to prove what is a lifelong disability for me. Thank you.
Thank you, Madam Chair.
Thank you, Madam Chair. Senate Bill 219 is the first one I have, if that's the committee's pleasure. Madam Chair, there is a one amendment to be made. I have one, thank you. And if I may explain the bill, that'll help explain the amendment. This is a bill that comes from the Veterans Strategic Plan Work Group that was directed by last year's General Assembly to convene this past summer and fall. They published their report this past January, and this bill is action item 2.3. And what it does is we already provide tuition assistance to members of the Virginia National Guard to go to college. It had for a long time been the case that the National Guard would pay the colleges directly. That was changed a few years ago so that the guardsmen would have to pay out of pocket to the colleges first, and then they would get reimbursed by the National Guard out of the tuition fund. And so they're asking to go back to the way that it was, where they don't have to come out of pocket first, but instead the Guard just pays the colleges directly. And so that's what the bill does, and the amendment is just to make explicit that the grant funds shall be dispersed to the applicable institution of higher education, which it's the mechanism so the colleges get paid.
Moved and seconded that the amendment be adopted. All those in favor, please say aye. Aye. Those opposed? Okay, the amendment is adopted. Anything additional on your bill itself?
No, Madam Chair.
Questions? Senator Aird.
Thank you, Madam Chair. Senator Sturdivant, I was looking at the language, and I was wondering if you could clarify the change to good standing and how that is to be interpreted moving forward with this change.
Yes, Madam Chair, Senator Aird, the current law on the books has kind of a complicated good standing definition, and it says that it has to have a passing grade in each course during the semester, maintaining a cumulative GPA of at least a 2.0 on a 4.0 scale, and it means the individual has fulfilled all obligations to the institution of higher education. And so that's very, very vague. And so the idea is to make it less confusing by just saying, according to the standards of the school, are you in good standing? And that's all that matters.
Thank you.
Other questions? Senator Van Valkenburg.
Thank you, Madam Chair. I guess on that point, why are we striking that section? Why don't we want them to be in good standing? I mean, I guess I don't understand. I mean, I understand the payment piece to this. That makes sense. That makes a lot of sense to me. I guess the good standing piece doesn't make a lot of sense to me.
Madam Chair, Senator Van Valkenburg, if you look at line 17, the good standing language is added there. And so it's just taking out that paragraph 2, which kind of has a very long and confusing definition of good standing, and is simply leaving it to the colleges as to what their already existing definition of good standing is. That way the guardsmen are not having to meet two different standards of what the bill says, what the code says, and what the schools say. You just have to be in good standing with the school, which is really what it's getting at.
Further questions from the committee? Are there those here in support of Senate Bill 219?
Good morning, Madam Chair, members of the committee. My name is Alexis Fryer. I am the Policy and Legislation for the Department of Military Affairs, and we are in support of this bill. Not only has this adversely affected our recruitment rates, but also the guardsmen in general. So we would like this to go back to that pay directly to the institution. Thank you.
Thank you.
Good morning, Madam Chair, Senators. My name is Kevin Hoffman. I'm the Joint Leadership Council Chair. This is one of our initiatives for the year, so we do support this. Also, I'm a guardsman and have been for about 20 years. When we went from an upfront model to a reimbursement model, we've seen service members, the take rates drop by about 40%. So this has really been a bad change for us, and we would like to go back to the upfront model. We think it's a positive for the Guard.
Thank you.
Thank you, ma'am.
Ma'am, Russell Woodleaf with the Virginia National Guard. The good standing language, we're actually going back to what we had before. We didn't, as the senator said, that second paragraph there was added when we got into the reimbursement model. So this all just puts us right back where we were. Thank you.
Sir, could I ask you a follow-up question?
We have a question.
I just want to clarify, Madam Chair. So it's not lessening the standard. It's just making the standards consistent with your current practice. Is that correct?
It's putting the standard back to what it was before. It's making consistent with the schools with regards to good standing. I will say that at the very top portion of the legislation, as it has always been, the Adjutant General can make requirements on this, and grade point average is one of those things that have been required through our internal regulations for years. So it's not as if there is no standard, and there will continue to be a standard, and guardsmen have to pass their classes and so forth in order to get the benefit. Yes, ma'am.
Is there anyone here in opposition to Senate Bill 219? Okay. We need a motion on Senate Bill 219. It's been moved and seconded that Senate Bill 219 be recommended for reporting. All those in favor, please say aye. Aye. Those opposed? Okay. Your next bill, Senator Sturtevant.
Thank you, Madam Chair. Thank the committee, the subcommittee. Senate Bill 279 also has amendments. Senate Bill 279, Madam Chair, members of the subcommittee, is simplifying and streamlining the Virginia Commonwealth University Health System Authority. 30 years ago, I think it was under the Allen administration, you had MCV and you had VCU.
We need to adopt the amendments.
I'm sorry?
We need to adopt the amendments.
Yes, please. And the amendments are in line with what this bill seeks to do, which is to create more legislative branch oversight and executive branch oversight over large capital projects.
Okay, there's a motion and a second to adopt the amendments, and we need to figure out what these amendments are. Okay, moved and seconded that the amendments be adopted. All those in favor, please say aye. 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 Those opposed? Okay.
Thank you. As I was saying, we're reducing the size of the board from 21 members, which is kind of a large board, down to 15 members. And it's also requiring, sort of the substantive changes are requiring people with expertise in critical areas be members on this board. So things like asset management, academic medical center management, commercial real estate experience. And what this comes out of, there's the public safety building over by the John Marshall Courts building here in Richmond, just a couple blocks away. That was going to be developed into a 17-story office building by the Health Authority a few years ago. The pandemic happened, a lot of things fell through. Ultimately, VCU Health System was on the hook to the tune of $70 or $80 million to have to get out of that contract. It was covered in the media here in Richmond. Former Governor Wilder came out and spoke on it. But the idea is to just have a board here that is more collaborative, not as large, and has folks on it that are more geared toward the expertise needed, and to have additional oversight. So Senate Finance and House Appropriations have to be informed when certain capital projects are going to be done at certain levels. So the idea is that we're dealing with taxpayer money, that we're having appropriate oversight over the process. And that's really the long and the short of it, Madam Chair. And it's also extending the terms of the members on the Health Authority. Right now they have 3-year terms and they're not staggered. So you have the potential to lose a lot of institutional knowledge. And so this changes them to a longer term, and we have an enactment clause that will stagger the term so that we have some institutional knowledge that remains with the authority.
Madam Chair.
Everybody want, I have a question, then I can let y'all jump in. Okay, Senator Sturtevant, are you aware of the fact that there's a JLARC study that's reviewing the VCU health system and that this bill gets ahead of that study?
I am not aware that it was being done. I had heard that it had been asked by a senator a few months ago, yes.
Okay. Senator Aird, then Senator Head.
Thank you, Madam Chair. Senator Sturtevant, I was looking at the language around the additional qualifications that is sought with this bill, and aside from wanting to lessen the size of the board, could you not accomplish this makeup with the existing structure?
I think that would be possible, just not mandatory. And so we have some there's legislative slots on there. This bill takes those away. And so the idea is to really kind of bring it down to a more manageable size and mandate that we have those areas of expertise to help avoid issues like that Clay Street problem.
Thank you.
Senator Head.
Madam Chair, I'm just wondering if council can help me with looking at the amendments that we adopted. When I look at the second one here, it says line 234 introduced after. That whole thing, I can't find any of this language on these line numbers in the introduced bill.
Madam Chair.
The line numbers I find, but I don't find any of the verbiage that's there. So.
This is 279, Senate Bill 279 you're looking at, Senator? Excuse me, Madam Chair.
The same holds true for the second one, line 236. When you're saying strike the remainder of the line, and all those lines are already strict.
Madam Chair, Senator Head, yes. So the line amendments on paper look far more complicated than what they actually are intended to achieve. It is true that the language at line 234 after by, it's already stricken. After A, already stricken. That is because one of the amendments is essentially to unstrike the language that is stricken, beginning with this chapter at 234 through of the Commonwealth at 240. But due to the amendments and the way we would have to essentially renumber the A and B in parentheses to Romanettes I and II, it had to be broken up in sort of this complicated way on the sheet. So just a brief explainer, the first line amendment, which is to, after with at line 230, strike what is essentially just the cross-reference, Article 1, Section 2.2-1800 of Chapter 18 of Title 2.2, is striking what became a bad cross-reference due to the existing amendments in the bill as introduced, because the bill as introduced adds the language bonds may be issued in accordance with, and it used to say notwithstanding that cross-reference. And that is because that cross-reference does not give the health authority the power to issue bonds. So with the language saying bonds may be issued in accordance with, that cross-reference became incorrect. So that was stricken by the first line amendment. And then the second through fourth line amendment is, as I said, it looks way more complicated, but it's just essentially unstriking or adding back in the language from lines 234. So it would read, bonds may be issued in accordance with this chapter. However, each debt offering shall be submitted to the state treasurer sufficiently prior to the sale, all the way down through line 240 of the Commonwealth. And that was done because that requirement that the state treasurer be notified of such debt offerings is important to determine the impact of that offering on the debt capacity of the Commonwealth and determine if it could potentially constitute tax-supported debt or have an adverse effect on the potential debt capacity, in which case such offering would have to be submitted to the state treasurer as stated in lines 240 through 243 for review and approval. Thank you.
Madam Chair, if
believe it or not, I do understand that, so thank you.
Okay. I was just going to say, essentially, it's unstriking what was stricken, shouldn't have been in the draft. A couple of other minor changes because of a reference to the bond issue, but that's essentially what it does.
Good morning, Madam Chair. Jason Powell, Deputy Secretary of Finance. I want to compliment Council on explaining the amendment that was recommended by the Treasurer, and the administration is strongly supportive of the bill, and we are aware of the JLARC study, ma'am. Thank you for your time.
Others here in support? Is there anyone here in opposition to Senate Bill 270? I have one other question, Senator.
Yes, ma'am.
I have one other question. It states that the bill is requiring that the appointments by the Speaker and Senate rules basically is suggesting, no, it's not suggesting, it's telling the Speaker and Senate rules who they can appoint. Is that correct?
Not specifically who, but with the expertise. Yeah, I think that's a fair reading of it.
Is that wise?
I would defer to Madam Chair, as that's her committee. But I would just say that the idea is not to indicate who has to be on there, but that we have these relatively broad but nonetheless relevant areas of expertise when we're dealing with such an important health system and so many taxpayer resources.
A follow-up question to that. So we are assuming that legislative members do not have the expertise to be on the board of the VCU health system?
I would say that there are more likely than not folks outside of the House or the Senate who would have the relevant expertise.
Sorry, Pillion. Okay. We have SB 279 before us. Any further, we need a motion or any further discussion? Senator Van Valkenburg.
Yeah, speaking to the bill, and then I guess I'll have a motion. With that JLARC study in the pipeline, but also I'm very uncomfortable with changing the board the way that you're changing it, not only for the reasons that the chair laid out, but also taking away a lot of medical healthcare expertise off the board. And I think that gives me a lot of pause. And so I'm going to move that we, I guess, gently pass this one by indefinitely.
It's been moved and seconded that Senate Bill 279 be recommended for passing by indefinitely. Any further discussion on that motion? All those in favor, please say aye. Aye. Any opposition? Okay.
Ayes 5, no 0.
Okay. Thank you, Senator Sturtevant. You have Senate Bill 287. 287,
Madam Chair. This is a community college bill. If you go to the community college website, back in 2013-2014 school year, we had 273,000 people, Virginians, in Virginia's Commonwealth, in Virginia's community colleges. Last school year, we were down 70,000 students to 201,000. The annual FTEs, full-time employees of our community college system in 2013-2014 was 120,000. We're down, as of last school year, to 85,000 full-time employees. Our community colleges do amazing work, and so what this bill would seek to do is to create an upper division in our community colleges so that they can offer a limited number of baccalaureate four-year degrees, but specifically in areas that are high demand, workforce development needed areas. This is meant to complement our public 4 years and our private 4 years. It's not meant to compete with them. And so we put in this legislation that Chev will be able to draw a radius around our colleges and universities where the community colleges cannot offer these 4-year degrees that are already being offered at the 4 years. But the reason why this is so important, Madam Chair, members of the subcommittee, this is Dwayne Yancey from Cardinal News on October 2nd of 2023, just a few months ago. There are nearly 2 million Virginians who are 25 years old or older who only have a high school diploma. So 2 million Virginians who are over 25, they've only got a high school diploma. And we've got an additional 1.2 million Virginians who have some college courses, but they've not completed a degree. So we've got more than 3 million working age adults who lack a post-secondary credential. And once you hit that certain age and you're working and you're starting a family, these are not folks who are going to be able to go and enroll full-time as a freshman or sophomore at a UVA or William & Mary or Christopher Newport or whatever. They need a place to be able to go to finish that 4-year degree in their local community that works with their schedule, and that's our community colleges. That's a function, one of the important functions that they serve. And we talk a lot about the need for workforce development, and that is something that is unique to different areas of the state. In the Richmond area, we may need cybersecurity degrees. In Southwest, they may need nursing degrees. In Northern Virginia, they may need something else. But that's what this bill seeks to do, is to help address those 3 million Virginians who don't have that 4-year degree, to give them an affordable, close to home option that works with their schedule, their family, their life, while at the same time, making sure that we're playing nicely with our 4 years by making sure that there's not unfair competition for students. But I think not only do we have that radius that will be drawn around the colleges that Chev will be in charge of, but again, the demographic of our community college students of being, 25 or older, already having full-time jobs. These are not necessarily folks who are going to be going into those full-time 4-year programs to begin with. And I just note that our community colleges do a great job of affordability. It's $154 per credit hour, very, very affordable. And that's the bill. It's to help out those 3 million Virginians who don't have that 4-year degree, while also streamlining that workforce development process so that we can get people into jobs in their own communities. And I think this is especially important for places like Southside and Southwest Virginia, where you oftentimes will have people go off to college and they don't necessarily come back to work. But if you're able to get that 4-year degree in your hometown or nearby in Southwest or Southside, you may be more likely to stay and contribute to your community with that education that you've earned. And so that's the bill, Madam Chair.
Are there questions to Senator Sturtevant on Senate Bill 287? I have one. Is this in keeping with the mission of community college structure?
I think in the post-COVID age, Madam Chair, as everything has changed, the way that we work and learn has changed, I think that this is an evolution of what has traditionally been what our community colleges have done. But I think there's a time and a place for everything. And I think we are at that place where we're trying to get more people back into the workforce. We're trying to get them upskilled to be able to have the skills to work in a much more technologically demanding work environment now. And we just have so many people who don't have the ability to go, when they're 28 to enroll as a freshman at, UVA-wise and go full-time. This is giving them a way to get that 4-year degree in an affordable fashion. And again, it's something that's geared towards getting them a good-paying job in their local community.
Senator Head.
Thank you, Madam Chair. I'm a little curious about this because it would seem that, in the conversations that I've been having in my area, which is one of the areas where we are really desperate for workforce development. It's not been centered around baccalaureate degrees, but has been centered more around career and technical advancement and industry certifications and that sort of thing, which is where the community college system has been shifting and trying to make those things not be mutually exclusive, so that you could, I've been talking with the chancellor about the need for those programs to translate into college credit so that it could be advanced. But in addition to that, it sounds, this seems to be sort of blurring the lines. I'm concerned about the amount of faculty and resources that might detract from some of the industry certification programs that we've got going on at the community colleges. And in addition, you've got higher ed centers in a lot of these same areas that offer satellite degree programs similarly to what you're describing as far as flexibility is concerned. Would this not be diluting some of those efforts and trying to get everybody to get a college degree? I'm not sure that that's really meeting the needs. Can you help me with that?
Madam Chair, Senator Head, I don't think it's an either-or proposition. We can only do continuing education or technical degrees, or we can only do the four-year degrees. There's going to be the right option for each individual based on the field that they are looking to go into. But I think that's why it's so critical this bill gives all of that oversight to SHEV. This is not General Assembly telling SHEV and the community colleges what they have to offer or can't offer. It's saying SHEV, which has all the stakeholders at the table, is able to look across the entire Commonwealth and pick out unique areas and needs where maybe there isn't a need for four-year degrees in a particular area. There's a need for continuing education and technical degrees, but maybe another area there is, and a need is not currently being met. And I think that, again, the best example of are we meeting those needs is the fact that we have 3 million Virginians who don't have a degree beyond high school. And so there is a need. And this is, again, a sort of a both-and proposition that we can walk and chew gum at the same time and cover all those important bases, because they are all very important.
Other questions? Is SHEV here?
Madam Chair, Grace Qatar with SHEV.
Could you speak to, I'm just concerned about, is this changing the mission of the community college structure?
So SHEV does not tell the institutions what missions to have or not have, but we do have some considerations with this bill, just particularly around the fiscal impacts associated with offering baccalaureate degrees. We're not entirely too sure of what that cost would be. While their associate's degrees are pretty affordable, there could be other costs associated with offering baccalaureate degrees that we're not sure of at this time. In addition to that, enrollments at the upper division is unknown. We just don't know kind of what that would look like. And it's undetermined kind of what specific high demand fields would be offered and what would be selected to be at those community college systems.
So going from a 2-year to offering baccalaureate degrees, I guess I'm just concerned that this is no longer a community college.
Right. Our SHEV's understanding of community college is a traditional 2-year workforce credential style program. Of course, we're happy to work with all parties involved, but that's our understanding of community colleges at this time as well.
Okay. Thank you.
Thank you.
Senator Ayer.
Madam Chair, is someone from the VCCS present? I have a question. Good morning.
Good morning, Senator Ayer. Madam Chair.
some of the testimony that Senator Sturdivant has given here makes references to maintaining affordability should the VCCS evolve to offering baccalaureate degrees. And I am just curious as to if you can speak to that. It's my experience that when you evolve to offering baccalaureate, you're bringing on additional faculty, additional programming, and that comes with a whole set of additional administrative costs. And so are you able to speak to whether or not the VCCS is equipped to maintain current rates and evolve to offering baccalaureate degrees?
Thank you, Senator Ayer, for the question. So our primary mission is to deliver an increased number of Virginians with workforce credentials and associate degrees, and specifically in high-demand fields like healthcare, advanced manufacturing, logistics, IT, and energy. And we are working right now, and I know we've spoken to Senator Head about this, and some of the rest of you too, about renovating facilities and hiring additional faculty to deliver on that mission for affordable workforce credentials and associate degrees. We did meet with Senator Sturdivant once we saw the bill had been introduced. Certainly this has been done in other states like Florida. But I guess to answer your question, yes, there would be a fiscal impact on the VCCS to change to a baccalaureate model.
Thank you.
Senator Van Valkenburg.
Thank you, Madam Chair. Madam Chair, my question would be around the G3 program, which we did, I don't even know how many years ago now. But I guess
2020.
There we are.
The pandemic.
Yeah, so I guess could you just speak to kind of where you see G3 right now, like how successful it's been, what we could do in that space? Because I think a lot of like going for that high demand field through the community college, we tried to do that with G3. And to get people into nursing or computer science or whatever the field is. So,
yeah, so G3 is for Virginians who are at a certain poverty level, and there are funds for specific tracks, healthcare, IT, advanced manufacturing, public safety, and I'm sorry, I'm forgetting one of them, but that has been very successful. I mean, there's also been some interest in expanding some of those zip codes that are in the budget to more baccalaureate tracks, particularly along computer science and healthcare. So that is, I hope that answers your question.
Thank you.
Yes, ma'am.
Are there those here in support of Senate Bill 287? Anyone here in opposition to Senate Bill 287?
Madam Chair, members of the committee, I'm Lisa Gadati. I'm speaking on behalf of Radford University. At Radford, we strongly believe in creating opportunities for students from Virginia's community colleges and establishing affordable pathways for students to transfer seamlessly. I want to thank the Senator for his support of higher education, and I appreciate his interest in addressing workforce development in high demand and high need fields. However, we do have concerns with his legislation and the unintended consequences that would impact Radford University and other public and private institutions across the Commonwealth. Virginia offers world-class higher education opportunities. Virginia's community colleges offer high-quality workforce development, career and technical training, licenses and credentials, and associate degree programs. And there are exceptional four-year public and private colleges all across the Commonwealth in every region that offer baccalaureate degrees, and there's truly something for all Virginians. We are concerned about the potential impact to enrollment should community colleges have the authority to offer baccalaureate degrees. The enrollment cliff is coming, and there will be fewer Virginians to enroll in our bachelor's degree programs. Likewise, many surrounding states and out-of-state institutions are already offering Virginians in-state tuition, which further competes with Virginia's four-year colleges. Many of Virginia's public and private institutions are experiencing significant enrollment declines, such as Radford University, and we have the capacity to enroll additional students, and there is no demonstrable need for community colleges to offer bachelor's degrees. Chev, the VCCS, and the four-year colleges have invested heavily in creating transfer pathways, general education alignment through the passport and the Uniform Certificate of General Studies, and major pathways that have drawn higher education together as more of a system, non-system, and is improving the experience for our students. The investment in this transfer process allows for both community colleges and four-year institutions to build on our strengths and have a single collaborative focus, and we believe this bill would undermine those efforts. Thank you.
Good morning, Madam Chair, members of the subcommittee. I'm Sabina Moretz with the Council of Independent Colleges of Virginia. We too, like the Senator, are big fans of the community college system, but we associate ourselves with the comments of our colleague from Radford that there are unintended consequences for our colleges, which serve significant numbers of Pell Grant students, as well as adult students and place-bound students that could be harmed by unintended consequences of the bill. So, thank you.
Anyone else? Senator Sturtevant.
Madam Chair, members of the subcommittee, it really is about those 3 million Virginians who, whether we like it or not, more often than not, you got to have that 4-year degree. And we got just under 9 million Virginians total. That's a lot of people who don't have anything beyond college. And you need it, and you make a lot more money with that 4-year degree, and this is a way to help those folks who otherwise can't go the traditional route. Thank you.
Thank you. Senator Ayers.
Madam Chair, speaking to the bill, I'll echo some of the comments that were made here today and appreciating your effort to try and think through how do we get more credentials in the hands of more Virginians. That's something I care a great deal about as well. However, I think that this legislation is very dangerous. The community college system, as I recall, was founded and placed very strategically throughout the Commonwealth in very specific regions to do exactly what you're trying to accomplish, which is to allow access to credentials to be more accessible. And right now, you made reference to the gaping number of Virginians that don't have credentials, but you may be familiar with the reference in the Wall Street Journal that nearly 56% of individuals are just skeptical about whether or not there is value in continuing to seek a even 2-year or 4-year credential. And so I think you would agree, the community college system to not only continue to remain focused on how do we continue to maintain that affordability, that accessibility, and doing so in a way that meets the demands of today, but to also ensure that they don't cannibalize our 4-year institutions who, it's no surprise, are facing the enrollment cliff, are struggling themselves with soaring costs right now. And the last thing we need to do is pit the VCCS against them. And so, Madam Chair, I think we need to continue to have the conversation about how we increase access and maintain affordability and get the hands or get the access to credentials in the hands of individuals, whether that's a baccalaureate, a vocational credential, stackable credential, whatever it may be. But I'm not sure that this is the right way to do it. And so, Madam Chair, I'd like to move that we lay the bill on the table or pass by.
Pass by indefinitely.
Pass by indefinitely.
It's been moved and seconded that Senate Bill,
287.
That Senate Bill 287 be recommended to be passed by indefinitely. Is there further discussion? All those in favor of that motion, please say aye. Aye. Those opposed? Thank you, Senator Sturtevant.
Thank you.
With that, ladies and gentlemen, I think that completes our docket for this morning.
The Senate of Virginia, Richmond, Virginia.